How did ancient humans survive cuts, broken bones, infections, parasites, and childbirth with no hospitals? Did they have medicine, or did most people simply die? And what if the first healthcare system was not a drug but the group itself? Imagine a world where a bad tooth can become a death sentence, a broken leg can end your life, a cut can rot, childbirth can turn fatal, and there is no hospital, no pharmacy, no antibiotics, no anaesthetic, no X-ray, and no emergency room coming over the hill. The honest answer is brutal. Many ancient humans did not survive. Infant mortality was high, infection mattered, injury mattered, hunger mattered. But the surprising part is not that many died. The surprising part is that enough survived to carry knowledge forward. Survival without modern medicine was not one trick. It was immune systems, plants, fire, rest, experience, wound care, splints, anatomy learned by hunting, and above all, other people. The first medicine was not a pill, it was attention. A lone injured human is weak. A group can keep watch, bring water, share food, carry a child, protect someone who cannot walk, clean a wound, and remember which plant made pain easier last time. Care turns weakness into a shared problem. Before we talk about surgery, we have to talk about ordinary knowledge. Hunter-gatherers did not need a laboratory to notice patterns. Which bark tastes bitter, which leaves stop itching, which smoke repels insects, which mud cools swelling, which wound smell means danger. That does not mean every plant story was true. Ancient people could be wrong, just like modern people can be wrong. But useful knowledge does not need chemistry vocabulary to begin. It needs pain, trial, memory, and someone willing to teach. Dental calculus, the hardened plaque on ancient teeth, has become one of the strangest medical archives. It can trap bits of food, plant microfossils, smoke particles, bacteria, and DNA. In the mouth, researchers can sometimes read traces of diet and disease. Studies of Neanderthal dental calculus found evidence for plant foods, cooked carbohydrates, smoke exposure, and in some cases possible medicinal plant use. One famous sick individual from El Sidron had a dental abscess and gut parasite, and traces linked to poplar, a plant associated with salicylic acid. This evidence has to be handled carefully. Finding a plant trace does not prove a prescription. It may show diet, environment, accidental exposure, or deliberate use. But the bigger point is strong. Ancient humans and their relatives were not passive against pain. They interacted with the living pharmacy around them. Plants could help, but plants were not magic. Without antibiotics, a deep infection could still win. Without modern surgery, internal injury could still kill. Ancient medicine was not a cure-all. It was a narrow bridge over a very wide danger. Fire was part of that bridge. Fire gives warmth to feverish bodies, light for care after sunset, smoke that can affect insects, heat for drying materials, and a way to cook food so the sick can digest it more easily. A hearth was also a clinic. Then there were bones. People who hunted animals saw anatomy constantly. They knew joints, tendons, blood, organs, and breaks in a practical way. A hunter who can butcher an animal is already learning where bodies open, where they bleed, and where they fail. That knowledge could become treatment. A broken limb can be kept still, a wound can be covered, a thorn can be removed, a bleeding cut can be pressed, a burned area can be protected. None of this requires modern theory, but it does require observation and patience. The most shocking evidence comes from Borneo. In Liang Tibo Cave, researchers reported a person whose lower left leg had been amputated at least 31,000 years ago. The bones show the person survived for years afterward. Think about what that means. Someone had to remove part of a limb without killing the patient immediately. Someone had to control bleeding. Someone had to keep infection from destroying the wound. Then the group had to support that person long enough for years of bone remodeling to appear. The study does not mean every Stone Age group could perform complex operations. It means we should stop assuming ancient people were helpless. In one case, at least, knowledge, courage, and care were strong enough to cross a line we once thought belonged to recent history. Pain management was another problem. Without anaesthetic, care had to be terrifying, but humans had social tools: restraint, voice, rhythm, ritual, expectation, touch, and plants that could alter pain or fear. The mind itself became part of treatment. Ritual does not need to be fake to matter. If a chant steadies the patient, if a repeated act lowers panic, if the healer's confidence keeps the group organised, then ritual can help survival, even when it does not kill microbes directly. Infection was the enemy nobody could see. Before germ theory, people still noticed that dirty wounds could smell, swell, darken, and kill. They did not need microscopes to learn that some wounds must be cleaned, opened, covered, warmed, cooled, or left alone. Birch bark tar is a useful example of how complicated this story can be. Archaeologists know it as an ancient adhesive. Experimental research also shows antibacterial properties in produced birch tar. That does not prove Paleolithic people used it as medicine, but it shows that technologies could have unexpected biological effects. Ancient humans also survived by avoiding illness before it happened. Camp placement matters, water source matters, smoke matters, moving away from waste matters, food sharing matters. Isolation from the sick may have happened by instinct long before anyone could explain pathogens. But the group was not always kind. A sick person costs calories. An injured hunter slows movement. Care is expensive. That is why evidence of long-term survival after serious injury matters. It shows that some groups paid that cost. This may be one of humanity's deepest advantages. We are not the strongest animal. We are not the fastest. But we can keep fragile people alive long enough for them to teach, remember, warn, watch children, make tools, and hold the group's story. An elder who cannot hunt may still know where roots grow after drought. A person with a healed injury may still make tools. A grandmother may know births. A scarred survivor may know which wound treatment failed last winter. Care preserves expertise. So ancient medicine was not separate from culture. It lived inside food, stories, fire, plant knowledge, tool-making, childcare, migration routes, burial practices, and trust. Healing was not a building. Healing was a network. The hard truth remains, modern medicine changed the game. Antibiotics, vaccines, antiseptic surgery, imaging, anesthesia, and emergency care save lives that would once have been lost. Romanticising the past would be dishonest. But underestimating the past is also dishonest. Ancient humans were not waiting helplessly for science to be invented. They experimented, remembered, cared, failed, learned, and sometimes achieved things that still shock archaeologists. The question was never whether they had medicine in the modern sense. They did not. The question is whether they had healthcare in the human sense. Knowledge shared around pain. And the answer, again and again, is yes. So how did ancient humans survive without medicine? Often they did not. But when they did, they survived through plants, fire, practical anatomy, prevention, ritual, memory, and the dangerous generosity of a group that chose not to abandon them. Before the pharmacy, there was the hand on the wound. Before the hospital, there was the camp. Before antibiotics, there was memory, risk, and care. Ancient medicine was fragile, but it was not empty. It was humanity refusing to let pain be private.